Hello, my name is Darriel Harris. I'm a first-year PhD student at Johns Hopkins School of Public Health. I'm going to talk to you today about a program that took place in 2011-2012 in South Sudan. We've never heard this before. We've never heard this before. This was the testimony that the people who sat through my two-day community health education workshop would say to me at the end. And I thought to myself, never? I wasn't teaching anything that was advanced. I was teaching people about mosquito nets, about pit latrines, about maternal and child health. I was teaching people how to avoid pneumonia, how to wash hands with soap. These are things that the NGOs of South Sudan and the Ministry of Health of South Sudan was teaching all the time. They had campaigns readily telling people, big billboards saying, wash hands with soap, moyo masabun. But somehow, the people were saying that they had never heard it until after the workshop. So then, the question became, what was different? What did I do that was new? Now, South Sudan is a country where it has one of the highest rates of children under 5 deaths. Most of those children are going to die from malaria or typhoid or some type of dysentery. And everyone knows that this is a serious problem. And everyone who lives in South Sudan, most people who have visited South Sudan know that malaria is a big issue and that clean water and safe water are big issues. Everyone knows it. It's no surprise. And then everyone knows what to do if you get sick with this. You go to the nearest hospital or health clinic, and you hope that that health clinic has a medical professional that has the expertise, that has the equipment and the medicine to diagnose you properly and then to give you the requisite medicine. And then people also hope that they have the money to pay for it. But what people don't always know is how to prevent these illnesses. And that's what I tried to teach, how to prevent these illnesses that were killing so many people, killing so many children and adults. Now, when I went there, I wasn't a healthcare professional. I was a new graduate from Duke University Divinity School. I nearly ordained minister. I had no public health experience, but Duke University sent me to South Sudan and said, Darriel, just do the best you can and see what you come up with. Further establish our partnership with the Episcopal Church of Sudan and let us know how it goes. So I went there and I realized that people needed prevention education. And I said, okay, well then let's teach them some type of preventive education. And then I was consulting with the people back at Duke, and they said, Darriel, make sure that you teach it for their ears. Don't teach it for your own ears, don't teach it for the scientific community, but teach it for them. So then I began to wonder, what is it that the people love? What is it that I can latch on to that they already know, that they already appreciate, that they want more of, and then latch on to that and give them something new? And then the answer was Scripture. The people of South Sudan, most of them are highly religious. If you go to your local church on Sunday, it's usually packed. If you go to a village church, then usually everyone in the village is at the church. And people love to hear stories about the Bible. They love to hear stories about theology. There's something that they're longing for. In South Sudan, most of the clergy have never had theological education. So they know something. They've been moved by another person's speech, by a bishop or so forth, but they don't always know all the details for themselves. So I said, let's teach health education and teach Bible at the same time, something that they want. So I went to all the NGOs and the Ministry of Health, and I asked them what are the best practices, and they told me. And then I fused that with scriptures. So when we talked about malaria, I didn't come before the people and have a chart and show the vectors and how malaria is transported from one thing to the next. I talked about Mary, mother of Jesus, and how when Jesus was born, that she wrapped him in swaddling clothes and laid him in the manger. And I asked the people, why did Mary wrap baby Jesus in swaddling clothes? And then the people would answer, oh, she wanted Jesus to be warm. And then somebody else would answer, she wanted to protect Jesus from the insects that may harm him. And then somebody else may answer, oh, maybe the manger was dirty, so she wanted to keep Jesus clean. And all of these are good answers. And then I would steer them and say, well, now, the real answer is that Mary wanted to protect Jesus from anything in the environment that would harm him. Now, what's harming your children in your environment? And everyone knew that the pesky mosquito was causing severe damage. And I said, now, if Mary was carrying if Mary had baby Jesus and they were in South Sudan with all these malaria-causing mosquitoes, what do you think she would do? And then everybody said, she would cover him. She would cover him. And then we talk a little further and we say, now whose responsibility is that? Is that the responsibility of the NGO? Is that the responsibility of the Ministry of Health? Or was that Mary's responsibility? And then people would say, oh, this is Mary's responsibility. So then the question becomes, now whose responsibility is it to make sure that your child is protected from the environmental dangers that are around them? And then the people would say, me. And they learned about malaria, not because I was teaching them about malaria, but because I was teaching them about something they cared about. I was teaching them about Mary. And then having a mosquito net for yourself and for your child didn't become a medical act, it became a faith act. All right? So then we would talk about Abraham and Jacob and how important it was for them to dig wells because they wanted fresh water, and how they knew once they found a place that had clean water that would be a place where they could prosper. And we would talk about how men had to be involved with the maternal process of their wives. So we would talk about Joseph and how Joseph was going to make a bad decision, even though he was a good man, before he was educated on what was happening with Mary. So if you want to make a good decision in your house, even if you're a good man, you need to be educated. And through this, I spoke something that was for their ears. They heard it. They heard about malaria. They heard about the father being involved with the mother during the pregnancy. They heard about all these different array of topics that we covered for the first time, even though it had been spoken to them 10 times, 20 times in some circumstances. 80% of the world is religious. They claim some affiliation to some religion. And all of us are trying to change behavior, and we're trying to do something that's going to be effective. Well, why not use not just the network? I think we do pretty good at using the networks of religion. But why not use also the language of religion to convey something that's very, very important to all the people? Why not use something that they already love to convey something that they need? And I think if we can do this, then we can be impactful. In South Sudan, we come back to the villages, and sometimes the whole villages would have mosquito nets. Over 100 pit latrines were dug. And we saw people washing hands with soap for the first time. We have to speak for their ears. And sometimes religion is the best way. Thank you.